Good morning/afternoon, everyone. Today, we'll delve into the Comprehensive Metabolic Panel, commonly referred to as the CMP, a crucial diagnostic tool in assessing an individual's overall metabolic health. The CMP offers a snapshot of the body's blood chemistry, providing insights into how the body is utilizing energy and a quick check on the functioning of vital organs like the liver and kidneys. The CMP is a routine health evaluation that encompasses a broad range of tests. It assesses various components, including glucose levels, calcium, proteins, electrolytes, and markers for kidney and liver function. While the CMP is aptly named a metabolic panel, it's important to note that it does not include thyroid testing, which is often a separate evaluation. Allow me to walk you through the tests included in the CMP. We'll have dedicated lectures for each specific area, where we'll cover related conditions in greater detail. This slide illustrates the analyte overlaps between different clinical chemistry panels, such as the Basic Metabolic Panel, BMP, Electrolyte Panel, Hepatic Function Panel, and Lipid Panel. As you can see, the CMP encompasses tests from various panels, providing a comprehensive overview of the body's metabolic state. Here, we have a comparison of the tests included in the Basic Metabolic Panel, BMP, and the Comprehensive Metabolic Panel, CMP. The CMP expands on the BMP by including additional tests for liver function, such as alanine transaminase, ALT, aspartate transaminase, AST, and bilirubin. While the cost difference between the two panels is not significant, the CMP offers a more comprehensive evaluation of metabolic function. Moving on to glucose, elevated levels often indicate diabetes or the need for follow-up testing. However, it's essential to consider the patient's history, as other conditions like excessive food intake, acute physiologic stress, endocrine disorders, or certain medications can also elevate glucose levels. This slide provides a reference for interpreting glucose levels in the context of fasting blood glucose. A level between 70 and 99 mg/dl is considered normal, while a value between 100 and 125 mg/dl indicates prediabetes, and 126 mg/dl or above on multiple occasions is diagnostic for diabetes. The CMP evaluates two key protein components, albumin and total protein. Albumin makes up approximately 60% of blood proteins, while total protein levels can decrease in conditions that impact protein production, such as malnutrition, cancer, or severe liver disease. Conversely, total protein levels may increase in inflammatory disorders or dehydration. Calcium levels are also assessed in the CMP. Hypercalcemia can be indicative of diseases that cause bone turnover, such as cancer or parathyroid disorders. Ionized calcium, ICAR, is often a better test for parathyroid evaluation than total calcium, TCAR. Hypocalcemia, on the other hand, may suggest liver disease, malnutrition, or malabsorption issues, necessitating follow-up testing with total calcium and ionized calcium levels. The CMP includes an evaluation of key electrolytes, sodium, potassium, chloride, and bicarbonate, also known as carbon dioxide. These electrolytes play crucial roles in regulating fluid balance, acid-base balance, and various physiological processes. Hyponatremia, or low sodium levels, can result from decreased sodium intake, increased sodium losses, increased fluid intake or retention, or decreased body water loss. It's important to understand the underlying mechanisms, as hyponatremia can lead to cellular swelling, potentially impacting red blood cells and neurons in the brain. Conversely, hyponatremia, or elevated sodium levels, can occur due to dehydration, impaired thirst mechanisms, increased sodium intake, or decreased sodium losses, as seen in conditions like Cushing's syndrome. Potassium levels are also evaluated in the CMP. Hypokalemia, or low potassium levels, can result from decreased intake, excessive losses through vomiting, diarrhea, or renal losses, or a relative decrease due to insulin-dependent diabetes. On the other hand, hyperkalemia, or elevated potassium levels, is most commonly seen in hospitalized patients with severe illnesses or those taking certain medications like angiotensin converting enzyme, ACE, inhibitors or angiotensin receptor blockers, ARBs, for blood pressure management, especially in the presence of kidney disease. Chloride levels often correlate with sodium levels and help regulate acid-base balance and fluid levels. Deviations from normal ranges can indicate underlying conditions like metabolic acidosis or alkalosis, cystic fibrosis, or excessive intake or loss of chloride. Bicarbonate levels are also important in assessing acid-base balance. Low bicarbonate levels can be seen in conditions like Addison's disease, chronic diarrhea, diabetic ketoacidosis, metabolic acidosis, or kidney disease. Conversely, high bicarbonate levels may result from severe, prolonged vomiting, lung diseases like COPD, Cushing's syndrome, or metabolic alkalosis. This slide illustrates the primary compensation mechanisms for various acid-base disturbances. For example, in metabolic acidosis, the body responds by increasing the respiratory rate, leading to a decrease in carbon dioxide levels, while in respiratory alkalosis, the kidneys compensate by retaining bicarbonate. The SAMP also evaluates kidney function through the measurement of blood urea nitrogen, BUN, and creatinine levels. Additionally, the BUN/creatinine ratio and estimated glomerular filtration rate, EGFR, provide valuable insights into kidney health. The BUN/creatinine ratio can help differentiate between various causes of kidney dysfunction. A ratio greater than 20, the first of may indicate prerenal issues, such as hypoperfusion due to heart failure, dehydration, or increased dietary protein. A normal ratio falls between 12:1 and 20:1, while a ratio below 12:1 suggests intrarenal or kidney damage, potentially indicating liver disease or malnutrition. Slide 20. Finally, the SAMP assesses liver function through the measurement of alkaline phosphatase, ALP, alanine aminotransferase, ALT or SGPT, aspartate aminotransferase, AST or SCT, and bilirubin levels. Elevated levels of these markers can indicate liver dysfunction or disease. This slide provides a sample SAMP report with abnormal results, highlighting the various tests and their reference ranges. Interpreting these results in the context of the patient's clinical presentation is crucial for accurate diagnosis and appropriate treatment planning. In conclusion, the Comprehensive Metabolic Panel is a powerful diagnostic tool that offers a comprehensive evaluation of an individual's metabolic health. By assessing glucose levels, proteins, electrolytes, kidney function, and liver function, the SAMP provides valuable insights into the body's overall metabolic state. Integrating the SAMP results with the patient's clinical history and physical examination is essential for effective disease management and promoting optimal health outcomes.